Okay, I'll come into the room. I'll do hand hygiene. I'll introduce myself to my patient here, and then I'll identify the patient and also double check the wristband. Okay, after that, I'm going to provide privacy, and then I'm going to go ahead and explain to the patient what we're doing today. Hello, Mr. Horst. What we're going to be doing today is a head-to-toe assessment. Let's go ahead and get started. So to start, I'm going to ask you some questions here. Have you or are you experiencing any headache, any changes in vision, any changes in smell, any changes in hearing? Are you exhibiting any neck pain, any like a sore throat, a cough? Do you have a history of any thyroid condition or disease? Do you have any pain in your joints? Have you noticed any changes in your skin like rashes or lesions? Do you have any chest pain or palpitations? Do you have trouble breathing, shortness of breath or difficulty breathing? Do you have any changes in your bowel or bladder function? Or are you experiencing diarrhea or constipation? And in your lower extremities, have you noticed any changes like edema or swelling or any changes in your skin tone and color? Okay, sounds good. All right, to start, we're going to go ahead and go through the general survey. So the patient, I will note that they appear to be sitting comfortably, that the patient is well groomed, that their speech is non-slurred, or that it's not slurred and is even and consistent. The patient's appearance matches their age and occupation. Okay, and then Mr. Horst, I'm going to ask you a couple questions here. Can you tell me what day it is? Can you tell me where we're at here today? And then can you tell me the precedent? And the patient appears alert and oriented. And we'll note that they are alert and oriented times 3. And then Mr. Horst, can you tell me if you're experiencing any pain? And you can rate that on a 0 to 10 scale, 0 being no pain, 10 being the worst pain imaginable for you. All right, it's at a 0. Okay, we'll notate that Mr. Horst is at a 0 of 10 pain. All right, and then for this portion, Mr. Horst, or for this portion, we'll notate for Mr. Horst here that their Glasgow Coma scale is going to be at a 15. All right, after that, we're going to move on to the regular assessment here. We'll inspect the skin. The skin appears to be intact. Skin tone is even. No abnormalities, no rashes, no lesions on the visible extremities that we're able to see. Okay, and then we're going to go ahead and palpate the skin here. So we're going to palpate. The skin is dry, it's warm, pink, okay, and intact, of course. All right, and then we're going to move on to the head now. So for the head, we're going to inspect the head. Then we're going to palpate the head here. Okay, palpate the head, and we're going to note that there are that Mr. Horst is atraumatic, normocephalic, no signs of trauma, no abnormal masses or anything. Okay. And then we're going to go ahead and move on to the eyes. For the eyes, we're going to perform the EOMs here. So if you can look at the tip of my pen and just follow it with your eyes and keep your head steady. All right, and keep following it. Okay. And then we'll check the pupils here. Pupils are even, they are round, and then they are reactive to light. Okay. So EOM's intact and Perlin noted. Okay. And then we're going to move on to the ears now. For the ears, we're going to inspect and palpate the ears, posterior and anteriorly. Okay, no tenderness. So again, no tenderness, no breakdown on the ears there. Okay, and then we're going to move to the nose now. The nose, we're going to check for patency. So, Mr. Horse, if you could plug or occlude one nostril and breathe, and then we'll do it for the same for the other nose, or for the other nostril. Okay. And then we'll note that the nares are patent. Right, after that, Mr. Horse, are you able to puff your cheeks out for me? Okay, can you smile for me? Can you raise your eyebrows? Can you say ah? Can you stick your tongue out or protrude your tongue? Thank you. And then we'll note that facial movements are symmetrical bilaterally. Okay. After that, we're going to go ahead and move down to the neck. Okay, and then for the neck, we're going to go ahead and inspect, all right, and palpate here. Palpate the cervical lymph here, and there's no notable palpation for the cervical lymph, no abnormal findings. And then we're going to palpate the carotid bilaterally, and we're going to do them at separate times. All right, side here, side here, okay. And then we're going to note that the carotid pulse is at a 2+. All right, so Mr. Horse, I'm going to go ahead and auscultate the carotid. When I tell you to, can you please hold your breath? Okay, hold your breath. All right, you can take a few breaths here, and we'll do the other side. Hold your breath. Okay, sounds good. And after auscultation of the carotid, you can go ahead and note that there were no abnormality or abnormal sounds, no bruits. Okay, and then we're going to go ahead and inspect the trachea. The trachea appears to be midline with no deviations. Okay, we're going to go ahead and move down now to the anterior portion of the chest, or the so the chest here, and we're going to go ahead and listen or auscultate the anterior portion of the lungs. And where that's going to be is we're going to do the APCs, and then we're going to do the second intercostal space here. So the APCs on the regular person, up here. We'll do it bilaterally, and when doing it bilaterally, or when doing this at each location, we'll have the patient do one full inspiration, one full expiration at each location. So again, the APCs, then the second intercostal space, 2. Okay, so do it on the patient. Okay, and while we're at it here, we're going to go ahead and move down to the heart, and we're going to go to the 5 locations, and those locations are going to be, in this order, it's going to be on the right second intercostal space will be the aortic, the left second intercostal space is going to be the pulmonic, the left third intercostal space is going to be Erb's point, and the fourth intercostal space on the left side is going to be the tricuspid, and the fifth intercostal space on the left side is going to be the mitral. Again, on the regular person, it's going to be second, third, fourth, and then fifth. So we're going to listen on the patient here. Okay, so we listen to that. And then we're going to note on auscultation of the heart that the heart rate and rhythm are normal, and that there were no abnormal sounds heard, or auscultated no abnormal sounds. So no bruits, no murmurs. We're also going to note here that the S1 and S2, S1 is the closure of the atrioventricular valves, or the AV valves, and then the S2 is going to be the closure of the semilunar valves. Okay. After that, we'll have the patient stand up, and we're going to move to the posterior side of the patient. Okay, and then we're going to go ahead and auscultate the posterior fields or lobes of the lungs here. So we're going to start at the C7 here, go a little bit lateral to those, and follow down the spine at the 6 locations, one on each side, for the upper, middle, and lower lobes. And again, the same thing where each location you do one full inspiration, one full expiration. And you'll listen bilaterally. Okay. After that, we can note that the lung fields posteriorly and anteriorly are clear. All right, and while the patient is still standing, what we're going to have them do, or we'll have them give us their hand, and we're going to test the cap, or check for the cap refill or capillary refill. So for us, it would be like this. Okay, and we're going to note that it is the cap refill is under 2 seconds. And then we're going to locate the brachial and radial pulses. So again, brachial here, radial here on the patient. It doesn't really have an elbow here, but there we go. Okay. After that, we're going to go ahead and go through range of motion. So we'll have the patient have their arms out, and they're going to adduct here, going towards the body, and then adduct, going away from the body, and then we'll have them perform a supination motion here, and then a pronation, or pronation movement here, and then flexion and extension. With their arms still out, we're going to put our arms out too, and press against theirs and have them push up against it. Ours, push down against ours, push outward against ours, push inwards against ours. Okay, and then we're going to note that the patient exhibited full range of motion bilaterally, and that the muscle strength was a 5 or +5 bilaterally. Okay, and then after that, we'll go ahead and have the patient sit back down, and we'll have them lay down in the supine position, where we're able to now go to the abdomen. We're going to inspect the abdomen here, and we're going to note that there's no signs of trauma, no lesions, no skin, or no changes in skin color on their abdomen. And then we're going to go ahead and locate the 4 quadrants, and we're going to oscillate, starting with the right upper, then going clockwise. So right upper, left lower, right lower on the body here. Okay. Right upper, left lower, right lower. Okay, and after doing that, we're going to go ahead and notate that vowel sounds were heard across all 4 quadrants. After that, we're going to palpate 4 quadrants in the same order. We're going to do light palpation first. Okay, and then deep palpation. And then we'll note no tenderness found, and no masses found. No abnormalities or abnormal masses found. All right. After that, we'll have the patient sit back up, and we're going to go ahead and inspect their lower extremities. Can't really sit up. So, inspect the lower extremities. We're going to just check again the skin, color and tone, make sure that it is even, that the skin is still intact. We're also going to palpate the lower extremities. No signs of edema or swelling, so no edema or swelling here. Skin is, again, warm, intact, pink, and no signs of rashes or lesions. We're also going to locate the 3 pull sites here for us, and that's going to be the popliteal, which is behind the knee, if you can see that. And then we're also going to go to the posterior tibial, which is right here, and then the dorsalis pedis right here on top of the foot, in line with the big toe there. All right. And after that, we're done.